Hello guys, welcome back. Hope you all are doing absolutely fine. So today we'll be continuing with our pathology exam revision series with our next topic of necrosis. A short note. What is necrosis? Write the types of necrosis and describe their morphological features in correlation with miasm. Definition. Necrosis is defined as focal death along with degeneration of the tissue by hydrolytic enzymes liberated by the cells. It is invariably accompanied by inflammatory reactions. Causes of necrosis may be hypoxia, chemical agents and physical agents. Microbial agents, immunological injuries. Two essential changes bring about irreversible cell injury in necrosis: cell digestion by lactic enzymes, denaturation of proteins. These processes are morphologically identified by characteristic cytoplasm and nuclear changes in the necrotic cell. The cytoplasm appears homogeneous and intensely eosinophilic. Occasionally, it may show vacuolation or dystrophic calcification. The nuclear change includes the condensation of the nuclear chromatin, pycnosis, which may either undergo dissolution, karyolysis, or fragmentation into many granular clumps, karyohexis. So we can see it in this diagram. Necrosis and apoptosis. Necrosis and apoptosis. In the diagram A, cell necrosis is identified by homogeneous eosinophilic cytoplasm and nuclear changes of pycnosis, karyolysis, and karyohexis in this A part. And B, apoptosis, which we'll cover in the next topic. Types of necrosis. There are 5 types of necrosis: coagulative necrosis, the most common type; liquefactive necrosis, caseous necrosis, fat necrosis, and fibrinoid necrosis. Coagulative necrosis. Most common type of necrosis. It is caused by irreversible focal injury, mostly from ischemia and less often from the bacteria or chemical. The organs commonly affected are heart, kidney, spleen. Grossly, foci of coagulative necrosis are pale, firm, slightly swollen. With progression, they become more yellowish, softer. And microscopically, outline of all the cells are retained, so cell type can be still recognized by cytoplasm and nuclear details are lost, which is generally called as the tombstone appearance. Very important in the examination point of view, the tombstone appearances of the outlines. Necrose cells swollen and more eosinophilic. Necrose focus is infiltrated by inflammatory cells and dead cells. Phagocytos leaving granule debris and fragments of the cells. So this is an example of the coagulative necrosis, which is in the renal, kidney. Liquefaction and collicutive necrosis. Liquefaction necrosis occurs commonly due to ischemic injury and bacterial and fungal infections. It occurs due to degradation of tissue by the action of powerful hydrolytic enzymes. Examples are infarct brain and abscess cavity. Grossly, affected area is soft with liquefied center containing necrotic debris. Later, cyst well is formed. Microscopically, cystic space contains necrotic cell debris and macrophages filled with phagocytous material. Cyst well is formed by proliferating capillaries, inflammatory cells, and gliosis in case of brain and proliferating fibroblast in the cases of abscess cavity. Here we have an example of liquefactive necrosis in the brain. Caseous necrosis. It is found in the center of the focus of tuberculous infection. It combines the features of coagulative and liquefactive necrosis. Grossly, area resembles dry cheese, soft, granular, and yellowish. Appearance is partly attributed to the vistotoxic effect of the lipopolysaccharides present in the capsule or tubercular bacilli, M. tuberculosis. Microscopically, necrous foci are structureless, eosinophilic, and contains granular debris surrounding tissue. Shows characteristics granulomatous inflammatory reaction with Langerhans type of giant cell and peripheral mantle of the lymphocytes. Okay, so we have this caseous necrosis in the lymph node. Principles of necrosis. Fat necrosis, special form of cell death occurring at two anatomical different locations but morphologically similar lesions. It may be caused by trauma to fat cell by enzyme released from the pancreas. It causes necrosis of fat cells in pancreas and abdominal cavity. Grossly, it appears yellowish white and firm deposits of formation of calcium soaps impart necrous foci firmer, chalky white appearance. Microscopically, necrous fat cells have cloudy appearance and surrounded by inflammatory reaction. Formation of calcium soaps is identified in tissue sections as amorphous granular and basophilic material. Fibrinoid necrosis. It is characterized by deposition of the fibrin-like material which has staining properties of fibrin. It is encouraged and encountered in the immunologic tissue injury, arterioles and hypertension, peptic ulcer, etc. Microscopically, it is identified by bright eosinophilic hyaline-like depositions in the vessel wall or in the luminal surface of a peptic ulcer. Local hemorrhages may occur due to rupture of blood vessels. Miasmatic relationship. Homeopathy is a branch of medical science which deals with the medicines selected on the basis of symptom similarity. Miasms are dynamic disease-producing power which pollutes the human organisms with unhealthy tendency and become the producer of many diseases. As in necrosis, there is degradation of tissue which leads to cell death, so the main miasm is syphilis with sora in the background. There is development of disease which progresses on and leads to cell death, so chronic miasm is responsible for progress of the disease. With that said, thank you.